Chronic kidney disease associated pruritus, or CKD-aP, also called uremic pruritus, is a persistent itch that many people with CKD or end stage kidney disease experience. The itching can be mild or severe and may affect just one area or the whole body. Before diagnosing CKD-aP, doctors check for other possible causes of itching, like medication side effects, liver or thyroid issues, or skin problems. For many people, this condition can be overwhelming. It often disrupts sleep, daily routines, and overall quality of life. According to DOPS, about 37% of patients surveyed reported moderate itching and 7% had severe itching. Why does CKD-aP happen? The exact cause isn't fully known, but pruritus is believed to result from several CKD related changes, including mineral and hormone imbalances, such as those seen in secondary hyperparathyroidism, dry skin, or cirrhosis, which often affects people on dialysis and can get worse with fluid restrictions, chronic systemic inflammation, and problems with the immune system where certain chemicals in the body can trigger or make itching worse. Management and treatment options include optimizing kidney care by ensuring adequate dialysis clearance and managing mineral and hormone balance. Topical therapies, which are often recommended as initial treatment. This may include moisturizers or emollients or anti itch topical agents. Systemic therapies. Gabapentin or pregabalin may help reduce itching, but they can also cause dizziness or drowsiness. Other selected medications targeting itch pathways are used under medical supervision. Other therapies. Ultraviolet B phototherapy can help reduce itching by affecting the immune system, but it may cause sunburn, darkening of the skin, and a higher risk of skin cancer over time. It is not recommended for people waiting for a kidney transplant, those with systemic lupus erythematosus, or anyone taking immunosuppressive medicines. Right now, difelikefalin is the only medication approved by the Food and Drug Administration to treat moderate to severe uremic pruritus in adults on hemodialysis. It's a selective kappa opioid receptor agonist given through an IV at the end of the dialysis session. Some people feel better after treatment, but side effects can include dizziness, confusion, drowsiness, and diarrhea. Pruritus is a common but often missed problem in people with kidney disease. Although the cause is complicated, using a mix of good dialysis care, skin treatments, and targeted medicines can help reduce symptoms.